So this was the second of two linked guidelines from the European Stroke Organisation, and I was very pleased to be part of a big team that worked on both of those guidelines. The first guideline, which came out in 2022, looked at what's referred to as covert small vessel disease, and the most recent one that's just come out, part 2, is specifically about patients who present with a clinically evident lacunar ischemic stroke. So lacunar ischemic stroke is frequently due to the same intrinsic small vessel disease. Sometimes it can be due to an embolus, sometimes it can be due to atherosclerosis, but in large part it's an intrinsic problem. And so in this second guideline, which is published in the European Stroke Journal, we examined acute treatments and also long-term secondary prevention treatments, and we have looked across a range of interventions such as thrombolysis, acute blood pressure management, acute antiplatelet treatment, other novel agents, and we also looked at progressing lacunar stroke, because progressing lacunar stroke is actually quite a high proportion of people. It's about 25 to 30%, and it's a big problem. And then we also looked at longer-term secondary prevention, so blood pressure lowering, antiplatelet drugs, lifestyle interventions, lipid lowering, and what was the other one? Novel interventions. We've done a very thorough job. It's built on massive examination of the existing literature, systematic reviews, meta-analyses. We did several new analyses as part of this work, including network meta-analysis of the antiplatelet drug work. What's slightly frustrating is the consistent problem that lacunar stroke tends to get dumped in with all the other types of stroke. So when you try and dissect out, for example, the data on thrombolysis, there are relatively small numbers of lacunar stroke patients included in the thrombolysis trials, but we've tried to do as much as we could with the evidence. And for most acute stroke treatments like thrombolysis, like starting dual antiplatelet treatment short term, we didn't find strongly compelling evidence for it. On the other hand, we didn't find good evidence against it. And so for the time being, the argument would be to use these conventional acute ischemic stroke treatments, but just in the back of your mind, be aware that the evidence base is not great. For long-term secondary prevention, key things are blood pressure lowering, and the more intensive blood pressure lowering, the better. Again, the evidence base is not massive, but there's a lot of common sense behind that. For antiplatelet drugs, there's evidence that a single antiplatelet drug is probably beneficial, but again, there's a lot of data, but it's not the most compelling evidence. Lipid lowering, very limited evidence, specifically in lacunar stroke, but there is wide evidence for lipid lowering more generally in the prevention of cardiovascular disease and stroke. Lifestyle, the biggest one is smoking cessation, and then exercise and, limited body weight. Again, not a lot of direct evidence, but it's very common sense and it's widely promoted. And in terms of novel agents, there are one or two beginning to come through, but not sufficient to be considered as a phase 3 or, to be mentioned in guidelines. So we have listed those, and there's some interesting work going on, and hopefully this will stimulate more. But anyway, you can read it all in great detail, including a lot of additional information in the supplements. So I commend it to anyone who is trying to manage patients with lacunar stroke.